Hello everyone, I'm Zhihui Ouyang, and the research question I choose is can increase the calcium intake reduce the risk of bone fracture? And to be specific, the question I choose is can increase the calcium intake, higher milk consumption or dairy products reduce the risk of bone fracture? And I divide it into the three parts. The first part is the background information. What is calcium? The second part is evidence and studies. Also, I have three research questions in this part. And the third part is my opinion and some thoughts. Also, the conclusion. So for the first part, background information. What is calcium? Calcium is a dairy supplement and antacid. It can supply the body with the calcium if the regular diet does not provide enough. It can also prevent weak or brittle bones and can lead to osteoporosis. How calcium worked? Tiny crystals of calcium from your blood spread throughout the collagen framework. The hard crystals fill in all the nodes and crannies. Calcium collagens work together to make bones strong and flexible. And how can calcium supplemented? The first one is recommended dosage. The recommended daily intake of calcium varies based on age, sex, and life stage. It is best to consult with the healthcare professional to determine the appropriate dosage for your specific needs. The second is calcium absorption. Calcium absorption is optimized when taken in smaller doses throughout the day, as the body can absorb only a limited amount of calcium at once. And the third is consider other nutrients. Adequate intake of vitamin D is essential for calcium absorption. It is often recommended to check vitamin D levels and consider vitamin D supplementation alongside calcium supplementation, especially if deficiency is present. And the last is timing and interactions. Calcium supplementations may interfere with the absorption of certain medications, such as antibiotics and steroid medications. It is advisable to take calcium supplements at least 2 hours apart from other medications to avoid any potential interactions. Okay, and then what is osteoporosis? And we keep in mind that is the fractures are the result of osteoporosis. Osteoporosis is a medical condition characterized by low bone density and deterioration of bone tissue, leading to weakened or fragile bones. And the cause of this disease may be because the age. As individuals age, their bone density tends to decrease, so making them more susceptible to osteoporosis. Also, gender. In general, women are at higher risk of developing osteoporosis, particularly after menopause, due to the decrease in estrogen levels, which plays a crucial role in maintaining bone density. Also may be because the hormone changes. Conditions or treatments that disrupt hormone balance, such as low levels of testosterone in men, can contribute to the development of osteoporosis. And there's some symptoms of osteoporosis, such as loss of height over time, and the people have this disease may have back pain caused by vertebral fractures or collapsed vertebrae. Also stop the posture or hunched back. And now we can continue into the research questions part. The first study I choose is a randomized control trial. And this whole group randomized control trial study from the University of Melbourne included like 16 accredited aged care homes in Australia. These aged care homes primarily accept older adults who are able to work, with a total of 7,195 elderly participants, and it is around like 68% of them are female, with mean age of 86 aged. Before the study began, both groups were at adequate level of vitamin D, with daily calcium and proteins intakes of like around 600 milligram and 57 milligram respectively. After the trial began, the intervention group would consume an additional 250 milliliters of milk and 20 grams of cheese per day, which would provide like 562 milligrams of calcium and 12 grams of protein, bringing the total daily calcium and protein intake of the intervention group to 1,142 milligrams and 69 milligrams, compared to 700 milligrams and around 58 grams in the control group. So during the average follow-up period of 12.6 months, they will have 324 fractures and 4,302 falls and 1974 deaths in the group of older adults, with 135 of the fractures being hip fractures. And after comparing the data, it was found that an aging population was increasing in the number of older adults currently requiring a care in nursing facilities, a population that tends to be more nourished, while the risk of fractures from malnutrition may be small for the individual. The large number of older adults in senior care facilities places a significant fracture burden on society. Researchers note that it's quite easy to increase calcium and protein intake through the use of dairy products, and there is high calcium and high protein nutritional intervention is effective and in reducing the risk of falls and fractures in older adults. And for this study, it's focused on Mediterranean style diet, and it's a longitudinal cohort study. This study including 82092 men and women at baseline, and adult and covariate data were collected twice, and between like 12 years apart using questionnaires. And this is a moderate to high dietary calcium intake in the context of an overall healthy diet were associated with lower hip fracture rate. And for the third research article I choose is the double-blinded randomized control trial. The goal of this study was to ascertain if 4 years of calcium supplementation would lower the fracture risk during the treatment and subsequent follow-up, and in the healthy people, calcium supplementation decreased the risk of both major and minor fractures, and they found that once the medication was discontinued, the benefit seemed to disappear. Okay, for the last, we can have some conclusion. The first conclusion is to prevent and treat osteoporosis and fractures. Adequate calcium and vitamin D are the basis, but does not mean that this two is sufficient. If it's necessary, combined with anti-osteoporosis to treat. And also, nutritional interventions high in calcium and protein are effective in reducing the risk of falls and fractures in older adults. And lastly is that the calcium supplementation should be in the moderation. Do not take it too less or too more. A minimum dose of 1020 mg of calcium is required for optimal effect. And when calcium is combined with vitamin D, the recommended minimum level doses of vitamin B is 800 IU. Okay, so here is all for the presentation. Thank you.